Okay, so now let's proceed with our myofascial assessment. So as we can see, there is some bowstring happening on the right, around the right waist. And now I would like to do the stork test. So what I would like you to do on my command, I would like you to raise the legs, each subsequentially, right and left. And then we will do the same thing, but with the arms up, okay?
Okay.
So please face this wall. If you're finding PSAS, S2. Now if you can please raise your right leg. Okay, go down. Please raise your left leg. Go down. Now please lift your arms up. Right leg up and down. Okay, now the same thing with the left leg. Up and down. Okay, so we can see, put your arms down please, thank you. So we can see that there is a restriction on the right side, because the left side, with the left side the pelvic drops inferiorly, the right side is stuck. So we can assume that there is some sort of lesion happening on the right. Okay, now I would like you to get on the table please, face up, head facing me. Okay, so now we will assess common compensatory patterns. So we're bringing neck to the flexion, moving right, and we're moving left. So the right movement is way easier. Now we're placing our hands under the scapula, doing the same thing. The movement to the right is easier. Now we're assessing the ribs. Movement to the left is easier. And with the pelvic diaphragm, movement to the right is easier. Okay, now we will assess the breathing. Okay, so for the lower ribs, there is a superior movement, but not enough lateral movement. For the upper ribs, enough superior, but the anterior movement is depressed. Okay, for the pelvic domes, no significant findings. Now I would like you to flip over on your stomach for me, please. Okay, now let's do the pelvic diaphragm. Do you have a permission to touch your glutes?
Yes.
Okay. Okay, the right side is restricted, then the sacral movement. No significant findings. Sacrum is in normal position, so there is no nutation or counter-nutation. Now we proceed to our palpation. So we are assessing tone, temperature, texture, 4 T's of palpation. So right off the bat we can tell that there is a hypertonicity in the right lumbar area. Temperature seems to be uniform against the whole range. And now let's do our over-the-clock facial assessment. So for the left side, the movement favors movement inferiorly, medially, and clockwise. On the right side, inferiorly, laterally, and clockwise. So based on our findings, we can assume that there is some sort of lesion happening on the right, because the body and the fascia always stands to hug the lesion. Okay, thank you. You can get up for now. Okay, so based on the assessment and based on our studies, we can conclude that there is a dysfunction in the thoracolumbar fascia. So it can be a result of prolonged sitting. So prolonged sitting, it kicks inflammation processes, and inflammation processes, they reduce the amount of water in the ground substance, and they make fascia more sticky. So that hinders the movement of muscles through the fascia. So if that's the fascia, it's harder for muscles to move through it because it's sticky. It moves as one unit now. So sticky fascia, it causes impingement of nerves and blood vessels, which can lead to muscle spasm and pain. So what I would like to do today is called fascia release techniques. So with the fascia release techniques, we are triggering mechanoreceptors. So those are the receptors that react to the mechanical force. And with that, when mechanoreceptors are triggered, they kickstart a cascade of processes in human body. So they improve blood circulation, they tend to change the production and the position of the collagen. The TGF-B1 is also involved in that, and ultimately they activating mechanoreceptors tend to decrease the muscle spasm and pain. Since during our intake I found no contraindication to perform those techniques on you, do you agree to do those techniques?
Yes, of course.
Okay, thank you.
Thank you.
Okay, so what I would like us to do next is the technique called lumbar roll. So I would like you to get on the side of the table, please. Okay, please bend your knees. Okay, this arm can go over here. This arm is stuck to the side. Okay. So what are we doing with the lumbar roll? We are placing our fingers on the lumbar area, and we do the roll. So the shoulder portion is rotated inferiorly and down to the table, and the lumbar portion is rotated toward the therapist and downwards. And we are feeling for the stretch. Okay, it is imperative to do these techniques on both sides. So if you can please lay down on your other side. Good. Okay, please bend your knees. Okay. We can also bring this leg down to make it more intense and to achieve a better stretch. There we go. Good. Okay. Now I would like you to get down on your stomach for me, please. Good. Now we will do the glute stretch. So with the glute stretch, we are crisscrossing our arms. Do you have permission to touch glutes?
Yes.
Okay, so one hand goes on the glutes, the second one goes on the lumbar region. And we're basically performing the stretch. Okay, again, with this technique, it is imperative to do the stretches on both sides. So with this technique, we are fixating the heel of our hand on top of ilium at the point of attachment of glute max. And on the opposite side, we are tracking the QL muscle and we are bringing them to the different sides. Okay, for this last technique, I would like you to flip over back on your spine, please. Face up. So the last technique we would perform is lumbosacral decompression. So with these techniques, we place our both arms. One is on the border of sacrum, the second one is on the spinous process of L4, L5, and we try to separate them. So ideally we need to feel the prolapse of our fingers in between the sacrum, so that means that the facial restriction lessens. So what I would like you to do is, can you please rotate slightly to your left side? Turn left. Okay. And now go back. Okay. Okay, you can come more natural. There you go. So what we did here, we placed our right hand, it went on the border of sacrum. Left hand is cupping spinous process of L4. And we're moving our left hand cephalically and the right hand inferiorly. Okay, and there we can feel the release. Okay, so after the treatment we need to reassess our body. Can you get up, please? Okay, good. So for the bowstring, we can assess that the bowstring lessens on this side. For the stork test, can you please face the wall? Good. I would like you to raise your right leg. Good. And not left leg. Good. Once again, right leg, not right leg, yes, down, left leg, down, good. Now raise your arms, go with the right leg, down, left leg, down. Awesome, so we increased mobility with your arms down, please. We increased mobility on the right. Now I would like you to get on your stomach here, please. Okay, so now let's get back to palpation and let's reassess the changes in muscle tonicity on the right, temperature and tenderness. So with our initial intake, the muscles on the right were hypertonic and there was a slight tenderness. So I can feel that the tissue is more pliable and there is less restriction on the right side right now. Muscles are still slightly hypertonic, but not as much as they were at the beginning. Okay, the temperature again seems to be uniform throughout the board. No changes in the sweat glands. Let's reassess the pelvic diaphragm. Do you have permission to touch glutes?
Yes.
Please take a deep breath for me. Okay, so the movement on the right is less restricted for the sacral movement. Okay, the sacral movement, it's okay. Okay, so that concludes our treatment portion of our session today.